Okay, so today's appointment is for Mr. Evans. Mr. Evans is wearing a fixed lower brace, and when we done his checkup, we found he had recurrent caries below an existing amalgam filling down on the bottom right tooth on the 4/6. So today's appointment is to replace the filling on the 6. So obviously you can see already on the x-ray it's quite deep. There's the nerve. And Mr. Evans has requested today that he doesn't want to use any local anaesthetic, which we would routinely do in such a fill-in, and he's going to use hypnotherapy on himself. So we'll undertake this procedure without any LA today, but still obviously remove all of the amalgam and then replace it. Happy? We're going to replace the amalgam on today. It's quite a big restoration. Okay. So there's the cavity finished. So like I said, it's quite a deep cavity, slightly below the gum at the back. That's the cavity cleaned, ready for restoring. So there's the completed amalgam in place. You just gently put your teeth together. Carried the procedure without using the anaesthetic. I was a little bit dubious because I've had patients before who don't like needles, and we've tried it, and it's actually quite uncomfortable, obviously, for patients, but also as a dentist, because they're constantly waiting for the patient to kind of jump, and so you've really got to be guarded, and you can't actually do a thorough job because you're afraid to go too deep or afraid to do too much. But obviously when I had the discussion with Mr. Evans before we started, he kind of put me at rest, so I just thought just carry on as if he was like completely numb. So I did, I wasn't being careful, I wasn't being gentle or anything. And to be honest, I actually forgot that he was a numb, so I just carried on as if like he was a normal person who was, had anaesthetic. Yeah, I think it went really well, and like I say, even at the end, because it was difficult not to put a band on the tooth because we had the braces on, I literally had to kind of wedge a band over pack it, and then cut back. But obviously I had to cut back the filling under the gum. And again, at one point, I did think to myself, oh, he's not numb, when I was kind of cutting his gum to remove all the excess. But obviously at the end, when questioned, Mr. Evans didn't feel anything, and like I said, throughout the procedure, he was completely calm, never flinched, never jumped. So to me, it was a success, and I think to the patient, it was a success. So very happy, very impressed.
Much.